Hello again, I'm Dr. Lonnie Herman, and you have recently tuned into my channel for sciatica or chronic back pain or back pain and leg pain. And you're most likely, or you or a loved one is most likely still suffering from this back pain that you've tried for many years to get rid of, and you're just not getting the relief that you'd hoped. Most of the patients who come into my practice are people who've been living with their back pain for many years. They've tried the injections like epidurals or cortisone injections. They've had sometimes some relief, but really not long lasting, and sometimes no relief. Other patients have tried medications like muscle relaxers, anti-inflammatories, and they're still not getting relief from that either. And other patients have tried chiropractic care. Others have tried physical therapy care and acupuncture, massage. They've tried just sitting in a jacuzzi. They've tried heating pads and ice packs and all kinds of things. And they've even tried to purchase some of the simple pills and potions from the snake oil salesman from the back of the magazine to try to rid their back pain. And what I'm here to tell you about today is there's something that's most likely missed with the physicians that you've been going to. Again, I did go to school to become a chiropractor, but I realized very quickly when I got out in practice that chiropractic was not the be-all end-all for people with their back and leg pains. And quite honestly, about 6 years ago in practice here, I was doing all kinds of tractioning and decompression and chiropractic and physical therapy and massage therapy, and people were still, there were still people who would get well. Let me not tell you that some people didn't get well with the care, but there was still that percentage of patients who could not get well. They would still have the burning leg pain, they would still have the back pain, they would still have a balance problem or a pain shooting into their foot, and I just couldn't understand why. So I got into school to get another degree in functional neurology. And again, functional neurology is different than medical neurology. In the world of medical neurology, which can be wonderful for some patients, it is most often, you get a diagnosis from a nerve test or an MRI or an X-ray, and you're given a pill or a shot. In functional neurology, we're able to assess your brain's function and see if it's not doing its job. Okay, so when we talk about, which I'm going to elaborate on that brain function in just a moment, but when we talk about back pain, I want to just share this with you, is we've got this great model of what the spine looks like, and what we've got to understand is that the spine itself should have a nice cushion in between the bones here, like a sandwich, and that it's a jelly cushion, a disc, and the space next to that cushion should have an open space for the nerve to come out, and there should be a nice open space for the spinal cord to run through behind the bone. That's a good, healthy spine. I've seen this type of spine in patients who are 70 years old, and I've seen it in patients who are 20 years old and all in between. So it's not about age that says, well, my back pain is this way just because I'm older, like some doctors may tell you. As the spine goes through its degenerative process, we may get this type of herniation where the fibers in the disc tear and the jelly comes out and sits on a nerve. When that happens, you may have pain that shoots down your leg, and that can cause the commonly called sciatica pain, or pain that just shoots into your butt. And then at the worst case scenario, for years of degeneration that have developed in a person for multiple reasons, which I can talk to you on another video about, but they can get this arthritis that sets in really deep into the spine, and it will actually choke down on the nerve. You can see here, and on this side, there's really no space for the nerve to come out of the spine, as opposed to the normal spine. Okay, so let me help you understand something about the human body and the nervous system, and why I am so successful in treating patients with their chronic back pain. First of all, there have been studies that have shown where they've taken the human nerve and put it into a pressured condition, thousands of pounds of pressure on the nerve, and the nerve was still able to fire electrical signals down that nerve. So that meant that if the nerve was pinched, could that nerve then be causing the leg pain or the numbness in the leg? And sometimes yes, but sometimes no. So when you go into a doctor who keeps cracking your back or stretching your muscles or riding the bicycle or giving you shots or giving you pills, the reason why you're not getting the relief is because it's not from a pinched nerve. Let me take you to another world, a deeper understanding of your nervous system, and help you understand why I'm so successful in treating people like you, who have these chronic back pain issues. And there are multiple types of therapies that I can use in the office to take care of if it is a disc problem, if it is a pinched nerve, and you'll see those in other videos that I'll be sending you. But mainly I want to talk today about brain. I want to help you understand something about your brain, that right in the back of your brain here, there's what's called the cerebellum. The cerebellum, which is right in the back of the human brain, is in control of your ability to stand up against the planet. It's against gravity. It's in control of your balance. It's in control of coordination of certain maneuvers that you do. It's in control of all the muscles along your spine. All of these back muscles are controlled in their function by the cerebellum of the human brain. It's an amazing piece of human brain tissue, is the cerebellum. When that cerebellum slows down, you may start to get a little wobble in your step. You may close your eyes when a neurologist tests you, and you may feel as though you're wobbling around. Or maybe you do notice that you have a little, your stance is not as strong as it used to be. Or possibly it's just constant aggravating back pain and leg pain. And it's, again, not because of the pinched nerve, but really because this part of the brain, your cerebellum, may be weaker on one side of the brain than the other. You do understand you have a right brain and a left brain. Hopefully you get that. And your right brain controls your left body, right? And your left brain controls your right body. Well, understand this. You also have a right cerebellum and you have a left cerebellum. And what happens to the human being is that your cerebellum may get weaker on one side than the other. So patients, when they come into my office and we do a simple neurological test where they close their eyes and they start falling over to one side or falling forward, and that tells me that the cerebellum of the human brain is weak. It's not doing its job. Let me give you a really bad scenario for a person is when they have a stroke. If that brain tissue has died, that part of the brain that died controls their speech or their arm. Their speech may not work normally, their arm may not work normally, or their leg, or their bladder, or their colon. Well, you can understand in that scenario when a stroke occurs how bad the body may malfunction. Well, on a less severe scenario is when the brain itself gets weaker. That part of the brain that's working at 60% of its normal ability or its capabilities, 60%. Do you think that if this is working at 60%, that the part of the body that it controls is going to work at 100%? I mean, think about that for a moment. If your cerebellum that controls your back muscles, the left cerebellum controls the muscles on the left lower back and the left leg, if it's only working at 60% of its normal physical, functional abilities, will the body feel at 100%? And that's simple. The answer is no. And in your cerebellum, you have these specific cells that we've studied in neurology that their job is to create a balancing act with how quick an impulse in the brain fires or how slow it fires. So when parts of the brain get weaker and they're not able to carry out their tasks, we may have more pain develop because the brain is not doing its balancing act of inhibiting nerve firing, and you get pain in the leg. Now, when you come into my practice for a specific brain-based neurological evaluation, as many other patients have, and I do these evaluations in here, some of them like your neurologist has done or your orthopedist has done, and some of them are different than what you've had done. But we were going to do in the office here a treatment right here in front of your eyes. And you may feel the pain decrease right away. But when we can understand, is it just the spine that's causing your pain, or is part of your chronic, long-term, not getting relief by pills, potions, lotions, shots, chiropractic, physical therapy, and the whole list of things, if your chronic pain is not getting relieved, your brain may be the culprit, and we need to therapy the brain. So hopefully you're getting some understanding here in this video that there is something else that you need to look at. I invite you into my office so that you can get a good neurological evaluation done that's different than what you've had done before. You can call my office at 954-370-3100, and I invite you in for this brain-based back pain evaluation, and you may witness right before your eyes that you can get relief, as many, many, many patients have. Watch the upcoming videos that I have coming to you describing other things that can cause pain, and watch the videos of other patients who've come here who've had relief. Again, the number is 954-370-3100, and I'd love to meet with you and help you, and I can help you.